Opportunities in Northern Colorado. Allie Steiner is our speaker today. Allie is a human resource specialist focused on recruitment at North Range Behavioral Health. After years of recruiting for one of the largest coffee companies in the world, she was excited to find a position in mental and behavioral health where she could make a difference in her community. Her passion is matching for candidates with their dream jobs in behavioral health or welcoming them into the agency with a plan on how to achieve their goals. When she is not working, she can be found trying new breweries or coffee shops or at a local farmer's market. Allie, thank you.
Thank you. Thank you guys so much for having me. My co-presenter, Caroline, is home with a sick kiddo today. So you just get me, which is almost just as good. So thank you guys so much for coming. So my presentation today is really just to talk to you guys about employment opportunities in behavioral health. So this slide deck is going to be kind of structured towards how North Range has our system set up, but you'll see that it's kind of interchangeable as you move between agencies or discover your career path within behavioral health or mental health positions. So we will get started real quick. We exported this from Canva, so I'm sorry not everything is lined up for you, but I just briefly wanted to tell you guys kind of what our agenda looks like. I'm going to do a quick introduction. I'll tell you a little bit about my background. We'll talk a little bit about maybe why you want to find a job in behavioral health, and then we'll dig into the job opportunities and have some time for questions and answers at the end. So I'm Allie. I am the recruiting specialist at North Range Behavioral Health. My contact information is up here, both my direct line and the email that I use at my work. I have been in recruitment for about 15 years. I worked for a really big, pretty popular coffee company, started as a barista and worked my way into national recruitment with them. My job was kind of downgraded, I guess, during COVID, and I found an opportunity with North Range Behavioral Health a couple of years ago, and I will tell you that I have never felt so at home in a position before. This has been incredibly awesome for me. So I'm excited that they asked me to share what kind of opportunities are going to be available for upcoming behavioral health seekers. So today I know that we had individuals who were invited from both high school, undergrad, and graduate classes. I don't want to spend too much time talking about one age group or one group if we don't have anyone there. So can I just see a quick raise of hands of who's here with an undergraduate degree? And is there anyone here looking for graduate experience? Okay, and any high school? Okay, perfect. So originally when we extended this event, it was open to some high school students. And so I do have a couple of slides in there. I'll probably touch on the jobs themselves, but we won't spend too much time going through it. Other than that, we do have our industry partners here and some community partners who are just setting in to get some additional information about what the career path in behavioral health is going to look like over the next couple of years, and especially right now. So I think it's always a good idea to talk about why you want to get in behavioral health. And I found that there are two types of people who identify with behavioral mental health because they have an emotional connection to it, and the people who recognize that it's also a business, and we need business-minded individuals to be in those positions. So I put together not a full example of what some of those close to heart feelings may be about behavioral and mental health, but you know, maybe you've experienced it, you've been through it with a friend or family member or yourself. That personal experience is huge when you're coming into our agency in this industry. Maybe you have a unique skill set where your friends have told you, Valerie, you've always been such a good listener. You do a great job helping me work through my problems. Maybe you want to make a difference in your communities. These are all really important factors when you're deciding, is a job in behavioral or mental health for me? Now, I did mention that there are some individuals who may have more of a business-minded side, right? We have those who need to be administrators in our facilities to provide the administrative duties of support. And so maybe you're looking at it as there's long-term effects of the COVID-19 pandemic where we need individuals who can come in and provide administrative assistance, whether it's documenting by helping clinicians get their information into their systems. if it's helping sort through resumes as people kind of move back into the workforce. We are in some times now where we are in a recession and there's been some economic downturn. People have lost jobs. People are not back to work quite yet. We seem to see natural disasters almost every other week with crazy weather right now. And then there's a lot of social unrest, right? A lot of us are nervous about what could be happening in any area of our lives. And then obviously the opioid crisis has been huge in the mental and behavioral health field. So those are just some ideas on why you guys may want to be in the industry. But I really want to talk to you, right, about where do I fit in? Because there's so many different positions. And I can tell you that as I was working on my undergrad, and I was like, gosh, I really want to go into behavioral health, but I know that I am not ready for clinical work yet. But I know I want to be there. Are there still opportunities for me? And yes, there are, right? There's clinical work, there's administrative work, there's IT, data management, medical records, community outreach, learning and development positions. And these are all very, very important pieces of the puzzle to make mental health and behavioral health successful. So this is kind of a graph of how specifically North Range is structured. We divide our agency into 4 different categories of crisis services, outpatient services, residential services, and specialized services. So really learning a little bit about where you think you want to start is going to be important. I can't stress that enough. When people come to me and ask me, Allie, where should I go? Or where do you see me starting? I always suggest that you start in a crisis program. Crisis can be a little bit scary if you don't know what it is, but it gives you the opportunity to see your community in every bracket of help, from the initial walk-in to the sending to an inpatient or an outpatient facility. And it really gives you that opportunity to work with every single age group right away. Some of those positions, the hardest part about finding a job in behavioral health, guys, is figuring out what is what, because we have so many different job titles for so many different things. So I do want to point out that crisis is a number of different positions, right? You may have been in some of our sessions earlier today where you heard people talk about our co-responder program, where we have clinicians who are embedded in our local law enforcement agencies, in our fire departments, that are really utilized to create a safe place for individuals who call 911 and may need support outside of just being taken to a hospital right away or being taken to a detox facility or whatever that looks like. So, and in those crisis programs, you have walk-in clinics, you've got respite care, so lots of different opportunities for you in crisis. Outpatient services, really, really cool. You guys are working with individuals who have potentially just come out of intensive inpatient services, people who have been in sobriety living, people who are continuing with their care. And so those could be early childhood, recovery support services, our medical teams, and residential, offering safe places for those individuals who may be struggling with finding a sober living facility. We have a program at North Range called Wings, where we allow both pregnant mothers or mothers who have just delivered babies to come and spend some time at our Wings inpatient program. And they offer support for mothers who are addicted or who are dealing with addictions. So it's a pretty cool program. And those are the types of services you may see in residential. And then finally, specialized services. North Range is home to one of 2 clubhouse models for vocational rehabilitation in Colorado. It's a super cool program where we have members and our counselors work directly one-on-one with these individuals. And it's such a cool program. And then additionally, we have kind of our educational support services and integrated care. So lots of different things that you guys can get into, and there's a huge need for this. I did read a report the other day that says Colorado is expecting adding nearly 50,000 jobs to the mental and behavioral health field in the next 3 to 5 years. Across the US, we're looking at more than 350,000 jobs. So that includes every education level that you could think of. It includes every degree type that you can think of. So when we were talking today, I really I want to make sure that everybody feels represented and understands that regardless of your decision to pick a graduate degree, licensure, just coming out of high school, there's opportunities for you. And we're so excited to get your specialized experience coming to us. Since we don't have any high school students, I'm going to skip over the high school slides. But these are really just opportunities for individuals who are coming straight out of high school, don't know what they want to study in college. Maybe they're taking a gap year, that there are some positions that they are more than qualified to work. We have our peer support specialists, which are incredibly impactful, guys. Those are individuals who have lived life experience through themselves, through a family member. Maybe they completed their recovery, and they can really partner with individuals to help peer-to-peer counsel them. And then also any of those administrative positions, environmental services, facilities, transportation, all really cool opportunities. But I do want to move over to, oh my gosh, our undergraduates. So undergrad is a lot, right? Because you guys are like, man, I'm so close to being done with school. I got an internship left. What am I going to do next? What are my opportunities? How am I going to get there? And so with your bachelor's degree, you guys, there are so many different things that you can do. We have both clinical and non-clinical roles for bachelor's level people. So that's going to depend on if you want to be working right next to somebody in a therapeutic setting, or if you want to support somebody more on the administrative side. Our bachelor level positions include case managers. As a case manager, you would help individuals find services they need, make sure that they're supported, make sure that they get scheduled, help them with day-to-day things that they may need. Behavioral health workers, which is kind of a little step above a peer. You're still providing some peer-to-peer support, but you're additionally maybe setting in with group therapy sessions, maybe working with a clinician and an individual on an individual session. Opportunities within finance and billing. And then I'm super proud to say that yesterday, North Range created a position for bachelor level mental health counselors. What this position is, guys, it is a mental health counselor. It's a stair step towards that clinical position. So this is so awesome because you're going to get the experience to get that clinical setting, get the clinical feel, and then there are programs out there to support you guys to go get your graduate degrees if that's where you want to head. And so the fact that you can find a program within development is huge. I know that many of the other agencies, my friend Caroline, who was going to present with me today, works at Summit Stone. So she, she has some similar stuff over there, but it's a really cool opportunity, guys, to be able to come in and see the work right away. One of the things that I think is super important to talk about, right, is how do I grow? Because as humans, we are conditioned to really think to ourselves, what's the next step? What can I continue to do with what I have to improve not only my professional roles and responsibilities, but maybe my earning potentials? So this slide is going to be very similar as we talk about undergraduates and graduates, right? There's 4 components that are going to give you guys the opportunity to increase both professionally and financially within our industry. So, the first one is certifications. So if you have your bachelor's and you're interested in receiving a certification, we do have a couple different opportunities that our agency, and I know Summit Stone and a lot of the other ones, will provide supervision hours for these particular certifications that can increase your earning potentials almost 20% with just the certificate itself. In any position that you guys find, continued education is always a big deal, right? It doesn't mean you have to go to grad school, but it means staying up to date on what's happening, participating in oh my gosh, I lost my train of thought. Participating in conferences that are around, participating in group studies that are around, being involved in the community, doing events like this, sharing your experiences. Oftentimes internal promotions or program changes can lead to an increase in pay or roles and responsibilities. And then finally, I wanted to talk a little bit about building equity in yourself. Community mental health is a great way to come out of come out of school and figure out what you want to do and where you want your specialty area to be, right? You've got a lot of opportunities to come in and see, is it outpatient? Is it inpatient? Is it residential? Is it crisis? Is it withdrawal management services? And that's going to be a huge component if you decide to excel yourself into private practice later. You're really going to get such a wide variety of individuals, and that equity that you spend building at those agencies is stuff that a lot of employers are going to look at as you move ahead in your career. One thing that I didn't know about behavioral health prior to starting is that sometimes the experience that people are looking for is post-degree experience. And so the longer that you can participate, or if you participate in an internship program that the agency has, you will get internship credit and be able to like still claim or put that on your resume as a job as well. So it's pretty cool opportunity in terms of that. And then it gives you that equity. Our agency does have a professional tuition assistance program where if you are a master's student, been accepted into grad school, or are currently enrolled in grad school, we have a tuition assistance program that will pay up to $6,000 a semester for tuition reimbursement. And then we also have a couple of different health sector partnerships that we have available for loan repayment programs. So really focused on developing your skill set, growing your skill set, getting that educational component. And as you stay with an agency, obviously relying on them to help educate you and get you into these positions is going to be awesome. And every single one of us wants to make sure that you guys land where you want to be. Graduate students are very similar, guys. Masters and beyond, right? It opens up quite a bit of different positions. You get the clinical component, so you can be a clinician. We've been talking a lot about our co-responder programs, which are huge. And so the co-responder clinicians are those clinicians that are embedded within our local law enforcement agencies, firehouses. They report out on any 911 calls that may have more of a behavioral or mental health. It may be more of a behavioral or mental health experience rather than having an officer pick somebody up and drop them directly off at a detox facility if that's not what they need. In addition to that, you really have the opportunity to branch specifically into inpatient and outpatient leadership roles, administrative roles, school-based positions. We do have clinicians embedded within UC Health for our program who are there to provide assessments if somebody comes in and we need to decide if it's more anxiety based or if there's something wrong. We have individuals who are there to be able to provide that type of support in that setting. So lots of community partnerships, collaboration, really, really awesome opportunities. Very similar to that slide that we just saw, guys. The ways to grow are exactly the same, right? There's certifications, there's licensures. If you attended the licensure class earlier today, you probably learned that some of the licenses that we really look for are those LPCs, LACs, LMSWs, LMFT, so licensed marriage and family therapists, clinical social workers, lots of different things. And most of the agencies that you'll apply for will provide you with those supervision hours. So that's huge to know that you can be at your job and you can be earning those supervision hours at the same time. Again, internal promotions and program changes can ultimately lead to increased job responsibilities and earning potentials. And then that equity component, again, guys, so huge. Caroline was going to talk about this a little, so I'm going to do my best to walk through this, but our loan repayment programs and tuition assistance programs are really awesome. So we offer North Range offers two different loan repayment programs, one through the National Health Service Corps and the other through the Colorado Health Service Corps. So these are loan repayment programs where you apply for the loan repayment and then you do make sure that you meet the required hours and the required classes, and then you keep your full-time job. Most of these loans do require a 3-year commitment at the facility that you signed on. So if you're working in a crisis facility, you would be responsible for working in a crisis facility for 3 years. If you're working in an outpatient facility, you would be outpatient for 3 years. Colorado Health Service Corps is very much the same. And then finally, I know I mentioned earlier our professional development tuition assistance program. This is brand new. We actually just rolled it out the first week of February. And we'll have 4 separate times for our internal individuals to apply. And that is open for both part-time and full-time people who have 6 months with our agency. I can't tell you how much I wish there was a tuition assistance program like this for me as I was finishing my undergrad. But I will tell you, this is the first time that I've seriously thought about going to get my master's, because outside of that, it's really hard to obtain that education and then come into a behavioral health position and think that you're going to make the money that a private practice person makes that's been licensed and has years of experience. And so I think the fact that you can have an employer who wants to invest that type of trust and empowerment in you is incredibly huge. So we've talked a lot about like some of our different programs. We've talked about the loan repayment. We've talked about degree levels. So how do you find your career? Researcher agencies, guys, there are so many different facilities throughout this county, throughout Larimer County, throughout the state of Colorado that are open for questions. They want to talk to you. They want to help you figure out, what does my career pathway look like? Reach out to them. They want to talk to you. I will tell you that if any of you called me and said, Allie, I really don't know where I want to be in my behavioral health journey. Can I just come sit in your office? Will you take me on a tour of your facilities? Can you tell me what CSS really stands for and what I'm going to find out when I'm there? I would love to do that. Take advantage of the internships, guys. Those are huge opportunities and stair steps into positions once you graduate. I know that Summit Stone is slated to open a new crisis facility next year, and they're looking for quite a few interns to help fill that. And I know that paid internships are a big deal and people are wanting those. So agencies are moving towards paid internship models. Not all of them are in place yet, but know that that is coming. And then finally, apply for jobs. I want you to know that if you guys are looking at job descriptions and you think to yourself, I can't apply for this because I can't check every single box on here, throw that away. If you guys can identify with 40–50% of what that job description says, apply for the position, take the interview. If you don't get it, use the information that you learned to mold yourself into the credentialing you need to move there further. There's so many different ways to acquire knowledge about positions and getting jobs and being in jobs and being successful if you just show up, right? Like if you go to the interview, if you take the phone call, doesn't mean that you're required to take the position, just means that you're interested in learning more about the role. Oh my gosh, why does this keep doing this? So this is my slide. I'm really proud of it because when I started in behavioral health, I was like, oh my God, it's so much harder to find clinicians than it is to find Starbucks baristas, right? I want you guys to remember that this is an incredible event that you attended today, and I think that you should all be so proud of yourself for coming. So as you walk through your journey of finding your role in behavioral mental health, make sure that you take some time to focus on yourself. Find what you want to do and be passionate about it and do it. Take care of yourself. If you need some time to unplug, if you need some time to cool off, take that time for yourself, you guys. We're humans, we deserve it. Remove your negative comparisons. Doesn't matter what somebody else did or how somebody else got there or what somebody else's resume looks like. Take that out, because the only person who can advocate for why you are so perfect for something is yourself. Build positive affirmations. You guys are so talented, coming up and knowing that you're in these positions because you want to see the difference. You want to provide a service. You want to show support is huge. Make sure that you remind yourself that you guys are superheroes. And finally, say thank you. Say thank you for all that you guys are doing for elevating your careers and finding out more information about our agencies, because that's super duper important. That's kind of my slide deck. I listed some resources. We are here today on behalf of the Northern Colorado Health Sector Partnership Behavioral Health Committee. So these are a list of the individuals who are active committee members right now. A lot of these will range from withdrawal management, substance abuse recovery. We have our hospitals on there, employment services of Weld County. These are all agencies that you guys can reach out to of people who have information about the career that you want to be in. And that's kind of my jam. So I know that was a lot of information really fast, but I wanted to make sure that we had good time for questions, because I know sometimes direct questions are way better than slideshow presentations. So does anybody have any questions about their path or what they think they want to do?
I have a question
Yes.
about the behavior, the bachelor's level
Mhm.
mental health counselor. Is that only full-time or is there part-time positions?
So we do have part-time opportunities available. We have 2 positions posted right now for part-time. One is through our functional family therapy and the other through our multi-systemic therapy. So those are both going to be in-home, youth and adolescent in-home opportunities. But yes, we do have those available right now. And I anticipate as we continue to roll out this program, which has been super successful in the 9 hours it's been posted, that we'll see some additional programs opening up those opportunities.
Allie, you have a question from the chat.
Yes.
Can we apply for internships as a sophomore in a bachelor's level program?
Yes, you can. We post internships traditionally twice a year, but we also are fully aware that sometimes that doesn't work with the student schedule. So if you guys have a desire to do an internship outside of a traditional internship schedule, please pick up the phone and call me. If our managers can take on an intern at that time, we onboard interns year round. So absolutely. Those are all posted on our website right now, just so everyone knows, and they are divided into both master's and bachelor level internships. Yeah.
Hi, my name is Shalina. I'm a junior right now here at UNC. I was wondering if I could have any advice. I guess be like more specific. So I'm looking for an internship in the summer and I'm not really sure like where to go.
Yeah, that's a great question. So I want to make sure everyone's represented here, but I know North Range best. It's my heart, it's my passion. So I'm going to tell you that we are having an internship fair next week, where you will have an opportunity to meet the program directors of our agency. We have 26 different programs and operate out of 19 different locations throughout Weld County. So pretty broad reach. I would say my advice is research, get on Google and say, you know, I don't know what your area of study or your desire would be, but substance abuse, crisis management, outpatient services, or visit the community mental health websites. We are northrange.org. We have a list of where we cover, who we cover, the programs that are offered. We do have our internships posted twice a year, but if you're interested in something outside of a traditional internship hour, we would be happy to work with you. Just go for it. Call me. Seriously, take my information, guys. And if you have questions, call me. We'll go tour our facility. We'll talk about some of our programs. We'll see how they work. I would love to do that with you. I would love to do that with you.
Based on our last session, it sounds like the career center here can help with things like that.
Mhm.
So be sure to work with UNC and your on-campus resources.
We have another chat question.
Yes.
So are you partnered with anyone who does undergraduate internships in the Southern Colorado area, closer maybe to the El Paso County area?
Correct. I can definitely put them in touch with a couple different agencies down there. Just for quick education, there are 17 different community mental health agencies in Colorado. We are all very collaborative in how we support and refer individuals for services. And we all cover different counties. And so I would love to get that information out there. So if you want to share my phone number or email with them, wonderful, I can get that set up.
I have a question.
Yes.
So have you ever had a person that started off with a job, part-time or full-time, and then transitioned to the process?
Mhm.
How does that work?
Yeah. So our only stipulations are that you can't do an internship under your current supervisor or in the same program. I don't want to say under your current supervisor because there is some wiggle room, but ideally if you had a full-time job at with our crisis response team, you could do your internship with like outpatient wings. You could do an administrative internship if that's what you were looking for. You just can't do it within your program. So yes, there's definitely opportunities for that. Huge. Yeah, absolutely. Absolutely. And what was that? Hello, hello, come in. Hello, okay. And just to kind of piggyback off of that, I really want you guys to know that the amount of support that agencies have right now is huge. There's behavioral health and mental health. There's a serious need for it, guys, a huge need for it, not just for our day-to-day consumers and our community members, but for us as well as behavioral health professionals. And so I want you to know that if you ever step into an agency and you took a job or you took an internship and you were like, oh my gosh, this is not what I expected, I don't like it, you don't have to leave the agency to go find something else. Get in touch with your HR department, get in touch with your program director, and let them guide you into the other opportunities that we have available for you. There's no reason that if you feel like you got yourself into something that isn't what you thought it was going to be, that you can't move into something else. And as you guys are developing your careers and getting in there, I think that's an incredibly impactful thing to be able to tell yourself is it's okay if today this isn't what I want to do for the rest of my life. Like, I'm going to go talk to Allie and see how I feel about working in withdrawal management. And I will be like, let's get you started. So. Yes, ma'am.
So one of our questions in the chat, I am a senior this year in hopes of applying to graduate school.
Yay.
My question to you is, what opportunities can I take being a UNC student who commutes from Colorado? I feel like I miss a lot of these opportunities because I am so far and only attend campus twice a week. I want to be a therapist, and I'm getting some misinformation on counseling and therapy. I'd like that one. Would this individual like some one-on-one practice? Do you have any advice for them?
Oh my gosh, I would love to talk to them. All of our agencies, again, are very supportive. We have incredibly different shift schedules. We have FTEs that are 0.2. We have individuals that work 6 hours a day, 1 day a week. We have the opportunity to be creative in staffing because ultimately, right, if we have a therapist that can work specific hours, we know we can see people at specific times. And so my answer to that question would be, again, to reach out to an agency as a commuter and say, this is my situation. Can we talk about what type of opportunity may be available for me so I'm not driving back and forth every single day? And again, part-time and full-time qualify for most of the loan repayment programs and tuition assistance programs. You can ask anything, seriously. You don't know, just it can be whatever.
So for the tuition assistance,
Mm-hmm.
so that if you have a job with you guys or like internship that can fluctuate, is that like flexible?
So the tuition assistance has to be specifically for a full-time or part-time employee. So internships wouldn't qualify at this time for that. I don't know what the future holds for that, but yes, as long as you have a part-time or full-time position with our agency specifically for 6 months, then you can apply for those programs. And yeah, it's super great. I can't wait to see all of the talent that's going to come out of that. I'm stoked. So excited. So excited. Yes, ma'am.
So you guys offer paid internships at Undergraduate?
I'm sad to say that we don't right now. I will tell you that we have some stuff in the works, and it's our goal to be able to provide that before the end of the year. We certainly recognize how hard you guys are working in your undergraduate and graduate degrees, and we recognize that it is a lot of work to go to school and have a job and be required to do an internship. And I will tell you that if COVID taught the world anything in mental and behavioral health, it's that we have to know how to pivot, and that we can't expect the impossible from people. And so I think really as we all kind of navigate back into what life is going to be like now, we learn that we're human, right? And we can't give 200% every single day and never need a break. So I'm happy to say that we are close, and I hope that by posting time next semester, we will be there. I do know that Summit Stone's new facility that will be opening next year, I believe is going to have some paid internship opportunities there. So that's the only one I'm really positive about right now.
Is that the Larimer County Behavioral Health?
No, so there's, yes, actually,
Oh, okay.
they will be responsible for doing some staffing for that. So yes. It's a crisis facility, I believe. So they'll have walk-in services, crisis management. I think their co-responders will be out of there. So lots of different opportunities with them too.
I think that's July of next year.
July of next year. Yeah.
UC Health has a component of that too. I work for UC Health. So,
Okay.
so we'll be involved with that. Summit Stone
Yes.
is kind of the main lead there. And I know our organization just started doing a lot with tuition, upping our tuition reimbursement. We've had that for years. They're increasing that and enhancing that for employees. And we have pension and all kinds of other retirement benefits. So as you're looking, even though retirement seems like it's decades away, as you're looking at all of these opportunities, because there are so many jobs and not enough people to fill them, I think you're going to start to see more and more organizations doing more to help you be successful, both with loan repayment, reimbursement for tuition, different career paths within organizations. So just ask lots of questions. Investigate. There'll be lots of people that are just waiting to hire you.
Yeah. And how great that we're also collaborative like this too, that as an individual who's interested in moving into mental behavioral health, you literally have an opportunity to walk into almost any community partnership here, whether it's the schools or the hospitals or, you know, libraries, whatever, to go in and be impactful to people. And I think that's incredible. And I think that's one of the things that I love so much about working here is that no matter where you go, you know that there's always somebody there who can support you in your journey, if it's, you know, personal, if it's professional, whatever that looks like. And there's so much different involvement within our community that, I mean, it's mind-boggling to me sometimes, like how much involvement we have, and I love it. I love it all the time.
Probably one of the things that makes mental and behavioral health unique in all industries. There's so much collaboration and partnership because there's not one organization that can do it all. We need everybody and probably more than even what we have right now.
Absolutely. Absolutely.
Allie, what would you say is the biggest thing that recruiters look for in applicants during an interview?
If I'm being honest, as me, as a recruiter, you guys, there are hardly any individuals that come across my desk that I don't pick up the phone and call. One of the things that I found that's lacking, and I can even say from my undergrad experience, is that nobody really teaches us how to make a resume. And even when they teach us how to make a resume, nobody teaches us how to make a resume that's going to get them appropriately placed and a wage they deserve for the experience that they have. And so really, I just think that one, you show up, whether it's phone or in person, and you just present yourself as you. As far as what we look for, you know, if you apply for a position where there's a required degree, based on just the specifications around that position, if you don't have a master's degree, then I'm not going to call you for that position, but I'm certainly going to pick up the phone and talk to you about how you can be a mental health counselor until you're ready to be a clinician. So I think, again, just reach out to me, guys. I'll talk to you all day about it. We can even go get a vanilla latte or caramel macchiato. I'll tell you how they made it and everything. Yeah. Yeah. No. The best way to think about it, I think, is just that it's a stair-step opportunity into clinical. I think it's awesome because it's separate from a case manager, right? As a case manager, you're getting one-on-one experience with people, but not necessarily providing the counseling component. And so I think that that's really awesome. And if you're really looking at your position and thinking about it, how great that you can work as a mental health counselor, apply for these loan repayment programs and internships, get your master's, and then be a clinician straight out of there, and then know that same agency is going to support you through your licensure if that's what you want to do. Man, I love all of our partners, but I really do. I love North Range, guys. I love UC Health. I'm a big UC Health person. It takes special people to be in these positions. And I'm so thankful that you guys came here today, and not to be like corny or feel like I'm tearing up a little bit, but this is like incredibly impactful to see as someone who's sitting in an agency recruiting, knowing that we have, 100 open positions, and knowing that we have so much opportunity, but how do we get it out? How do we make it public? And this is so cool. Do you have another question? Go ahead.
So what is that process, or like what do employers look for when somebody's doing an internship and they offer them a job, like through an internship? So like, what does that look like?
So our goal as an agency is to convert 100% of our interns. And so a lot of times, if you're interning in programs, you're going to get the opportunity to work cross-functionally with some other departments or other programs within our agency. Generally, after you complete an internship, your manager will approach you about staying on as whatever your degree qualifies for. So if that's a peer behavioral health worker, a mental health counselor, you will be approached. They want to keep you guys. Our programs continue to grow every day. It's very seamless. We also have the opportunity that if you're completing your bachelor's and you don't quite have it yet, where we can hire trainee positions. So maybe you work as a case manager trainee until you get your bachelor's, because you finish your internship, you just have to wait to graduate. So honestly, just call and ask those questions, but it's very, very seamless. And we hope that you would stay with us. Yes.
Another chat question. So we have a student who is a rehabilitation counseling student here at UNC, and they are wondering if they can work with North Range to help people with disabilities.
Oh my goodness. We have 2 internship opportunities right now with our Frontier House, which is a clubhouse model, one of only 2 in the state. So cool. I don't know, you guys should all tour the Frontier House if you get the opportunity. But what it is we put all of our vocational rehabilitation counselors, they work with the members. So those are community individuals who come in, they cook lunches, they do placement services for employment. They help teach everyone day-to-day living skills. They create opportunities for conversations. They coach for interviews. They help find jobs. And so it's really awesome. Tell that person to reach out for sure. Lots of cool things with Clubhouse. I know we have like 1 minute left, but thank you guys so much for coming and struggling through this with me as I learned how to talk about my slides that weren't my slides. So stressful.
We have one last chat
Yeah.
question. So this may be a bit specific, but this person plans to move back home to California next term, sometime in September after graduation. But do you all offer summer or temp work of any kind?
So we do occasionally have some temporary positions. Our biggest one was our grant-funded FEMA position that came with COVID, but those are ending. I would have to see what we could do, but I can definitely check into something.
Well, Allie, thank you so much.
Thanks for
being with
having
us
me.
today.
Yes, I brought business cards and stuff. No candy. I have a lot of Red Bulls in my bag. If you want one, I'm not going to drink anymore. But yeah, thank you guys so much for coming, and best of luck in your careers. You guys are all going to be great and be amazing. And if you need anything, I'm here for you.
And for our attendees, if you could please take the survey after the event, the flyer with the QR code on it. We would love to have you do that. Thank you all.